Hey, Assalamu alaikum. It's your boy Faizul Islam Faisal from Meditator video. And today I'm back again with a topic that is amenorrhea. And this is a topic from gynecology. What is amenorrhea? Amenorrhea, we know that absence of menstruation. But in this video, we'll talk about a pathological term that is cryptomenorrhea, which is very important for your prof examination, comes very often in written examination. So first, the definition of cryptomenorrhea. Menstrual blood fails to come out. Come out from where? Come out of the vagina because of any obstruction in its passage. Look at this. You can see a teardrop of blood. It cannot come out of the vagina. What may be the causes? The most commonest cause is the congenital due to imperforate hymen. We have learned so many types of hymen, right? So if the hymen is imperforate, then blood cannot come out, right? It's very simple and is the most common. The next cause is acquired due to cervical stenosis. What do you mean by stenosis? We know stenosis means narrowing of the lumen. So you can see here, because of narrowing of the lumen, blood also cannot come out of the vagina. So what happens when blood cannot come out of the vagina? Of course, it will get accumulated behind the obstruction, right? So this accumulated blood results in hematosulfings. What do you mean by hematosulfings? Hemato means blood and sulfings is the fallopian tube. So blood gets accumulated in the fallopian tube and we call this hematosulfings. Then hematometra, blood in the endometrium. Then hematocolpos, blood in the vagina, and which causes retention of urine. So we have learned the definition and what causes the cryptomenorrhea. Now, how a patient of cryptomenorrhea presents to a doctor? Look at this clinical feature. Since the congenital type is the most common, so aged between 13 to 15 is the most commonest presentation. And the most common symptoms, that is periodic pain in the lower abdomen. You see, and this lower abdomen pain is periodic. So in differential diagnosis with these symptoms, that is pain in the lower abdomen, we can say pelvic inflammatory disease, appendicitis, diverticulitis. There are lots of differential diagnoses with these symptoms. So we have to also exclude those differential diagnoses. The next symptoms is the retention of urine. Then on examination of the abdomen, we get a uniform globular mass in the hypogastrium. Look at this. In the hypogastrium, we got a globular mass on examination of the abdomen. Next, we'll inspect the vulva. On inspection of the vulva, we get a bulging hymen. If you see this picture, here you can see the bulged hymen because the blood gets accumulated behind this hymen. Okay. Then rectal examination, we find fullness of the vagina and red mass. How will you manage this patient of cryptomenorrhea? This is very simple since blood gets accumulated behind the hymen and this hymen is imperforate. So if you give an incision over the hymen, then this blood will drain out, right? So a cruciate incision of the hymen. Look, this is the blood in the vagina and here you can see the hymen. So if you give an incision, this is the cruciate incision, and then this blood in the vagina will drain out. Look. Yes. So if the cause is of imperforate hymen, then we'll give a cruciate incision of the hymen. And if the cause is of cervical stenosis, then we'll dilate the cervix in stenosis. So this is the management of cryptomenorrhea. So here's the end of our today's video, and I'm signing off. And if you guys do like the video, please give it a thumbs up and please share this video. Thank you all.